Hello, good morning everyone. I am Priya. I'm from University Putra Malaysia, and today I'll be talking on PET-CT in neuroimaging. My interests are in nuclear medicine and clinical radiology, with special interest in brain imaging. Today I'll be talking about the role of PET-CT in neuroimaging, and as an overview, I will be talking on Alzheimer's disease and other dementias, and how PET can help in the diagnosis, and PET-CT's role in management of epilepsy and brain tumors, and the emerging role of PET MRI scans. So as an introduction, there are various neurological and psychological disorders such as brain tumors, movement disorders, epilepsy, stroke, cerebrovascular occlusion disease, and dementia, which can be managed using PET-CT imaging. 18F-FDG PET-CT is often utilized for the assessment of brain tumors, epilepsy, and dementia in neuroimaging studies. The brain is an obligate utilizer of glucose, and thus 18F-FDG, being a glucose analog, can be utilized to assess the regional glucose metabolism in the brain. The brain takes up to 60 to 80% of the whole body glucose utilization per day. 95% of the peak uptake in the brain is achieved at approximately 35 minutes after the injection of 18F-FDG. 18F-FDG PET-CT can reflect the regional cerebral blood flow as a marker of the glucose utilization in the brain. So as you can see, the most avid uptake on the whole body scan is in the brain, where glucose is primarily utilized. Thus, sometimes it can pose a dilemma when there is poor tumor to background ratio. However, 18F-FDG PET-CT is very useful in various neurological conditions, and I will start with dementia. For dementia, it is a major neurocognitive disorder, and Alzheimer's type is involved when there is progressive, significant reduction in the cognitive function from previous level of cognitive function. There is reduced performance in neuropsychological tests such as the MMSE or MOCA assessments, and there can be significant impairment in the ability to independently perform cognitive activities of daily living. In the absence of delirium and other mental illnesses or medical conditions, the diagnosis of probable AD can be made. And if there is confirmatory evidence of amyloid pathology occurring in the brain, this can confirm the diagnosis of Alzheimer's disease. Previously, this confirmation occurred when there was a biopsy of the brain or autopsy, which is very invasive. Thus, with the utility of molecular imaging, which signals in vivo glucose metabolism of the brain and amyloid depositions in the brain, such as PET-CT using 18F-FDG or PET amyloid scans, we can actually make the diagnosis of AD in a non-invasive manner. With the assistance of lumbar puncture using the CSF biomarkers of amyloid are also useful. However, in the Malaysian and Asian population, there is some taboos and anxiety among the patients and family to undergo lumbar puncture. Therefore, using diagnostic imaging, which is non-invasive, is quite useful. 18F-FDG PET-CT has not only been a valuable tool in oncology imaging, but is also a very promising neuroimaging tool in the diagnosis of Alzheimer's disease. It reflects resting state cerebral metabolic glucose utilization in the brain, which is an indication of neuronal activity. Several studies have shown that cerebral metabolic alterations precede the clinical manifestations of AD symptoms, This can help us to diagnose AD in the early stages. 18F-FDG PET-CT is a biomarker for neuronal degeneration in dementia, and studies have shown that the appropriate use of 18F-FDG PET-CT for the evaluation of patients with dementia. Glucose utility in the cerebral hemispheres is usually symmetric, and the mean glucose use patterns of the cortex, caudate, and thalamus are equal in subjects of all ages. Thus, we can assess asymmetry or reduction or hypometabolism of 18F-FDG in the brain as evidence of aberrations in the brain's normal cognitive function. As an example, we can have radiological pattern recognition of Alzheimer's disease using 18F-FDG PET-CT, which was a pilot study conducted at the Center for Diagnostic Nuclear Imaging in UPM, or also known as PPDN. So the study was conducted in PPDN UPM, where the normal healthy brains of elderly subjects were compared with the age-matched AD. And this is example of healthy brain where there is homogeneous symmetrical uptake in the brain for the glucose metabolism. Whereas in the scans that were positive for AD, there is an evidence of glucose hypometabolism in the posterior parietal regions and in the medial temporal regions. Sometimes there is also evidence of extension of this glucose hypometabolism to the frontal regions, which can occur as AD advances. These are examples of several subjects with AD who had an 18F-FDG PET scan. As you can see, there is evidence of reduction of glucose metabolism in the medial temporal lobes, which is a common pattern in subjects with Alzheimer's disease. There are other dementia subtypes, such as dementia with Lewy bodies and frontotemporal dementia, which have pattern of glucose hypometabolism that are different from AD. In dementia with Lewy bodies, the predominantly reduced FDG uptake is noted in the occipital regions, especially in the visual cortex, and sometimes there is low FDG uptake in the parietal cortex. As you can see, the normal uptake is in the red color in the frontal and parietal regions. However, in the posterior occipital regions and posterior parietal regions, there is reduced glucose metabolism. However, in the precuneus and posterior cingulate cortex, there is preserved FDG uptake, and this is called the cingulate island sign that you can see in dementia with Lewy bodies. As opposed to patients with Alzheimer's disease, this area is also involved and therefore demonstrate FDG hypometabolism. And as for the frontotemporal dementia, the predominant glucose hypometabolism is noted in the frontal lobes and in the temporal region, with preservation of the posterior regions of the brain. Another radiopharmaceutical that can be used for imaging in Alzheimer's disease is amyloid imaging. Molecular imaging using amyloid PET-CT scan can provide in vivo functional information regarding the amyloid beta neuritic plaques burden in the brain, which is associated with Alzheimer's disease. Several pharmaceuticals that have been labeled with F18 include flobetapir by Amivid, Eli Lilly, flutemetamol, also known as Vizamyl, by GE Healthcare, and flobetabel, known as Neurasec, by Piramal Imaging, have shown high affinity and specific binding to beta-amyloid plaques in the brain. Beta-amyloid plaques can be detected in some elderly subjects who do not demonstrate clinical evidence of AD. This suggests that there is a possibility of preclinical detection of amyloid pathology in the brain, which can be a prognostic risk factor for eventually developing AD. Here, I demonstrate an example of a patient with a negative amyloid scan. there is good gray matter differentiation in the brain. As we can see, the gray and white matter cortices are well differentiated, and we do not see any abnormal beta amyloid deposition in the brain. As in comparison with this other patient, there is increased amyloid deposition in the posterior parietal region of the brain and some in the temporal regions of the brain. These areas also demonstrate loss of gray-white matter differentiation. This patient had a memory impairment with concurrent SPECT-CT findings suggestive of Alzheimer's disease pathology. As for epilepsy, it is another indication for the utility of 18F-FDG PET-CT imaging. Interictal PET-CT is commonly utilized to evaluate the brain glucose metabolism and can assist in planning for surgery in refractive seizures. Ictal PET-CT imaging, whereas, is another imaging where the imaging is done when the patient had, or rather the injection of FDG is conducted when the patient is having a fit. This is limited by several technical difficulties, but tends to have a high spatial resolution and can be used in the selection of certain patient subsets, which can be helpful to identify the seizure onset zone. During the interictal phase, there is 18F-FDG hypometabolism at the affected seizure onset zone, SOZ, and during the ictal PET-CT scan, the SOZ would demonstrate 18F-FDG hypermetabolism due to the utility of the glucose in the region that is actively firing the abnormal neurons, and there is like a steal phenomenon occurring during that time where there is a surge of blood to the region that is affected during the icteric phase. Here I demonstrate interictal PET that demonstrates low or FDG hypometabolism in the posterior parietal and occipital region on the right side, whereas during the ictal PET, which was during the active fitting, there was hypermetabolism and in the same region of the brain. These findings were able to help the surgeon to decide on surgical resection of the region that caused the refractive seizures. These were breakthrough seizures despite optimal medical therapy, and therefore these regions were amenable to surgery, and the patient responded well and became seizure-free after the surgery. 18F-FDG PET-CT can be used for the pre-surgical evaluation to localize epileptogenic focus in pediatric patients with drug-resistant epilepsy. A study conducted in Malaysia identified several different patterns of distribution. There can be focal unilobar hypometabolism in the interictal PET. There could be multilobar unilateral hypometabolism. There could be multilobar bilateral hypometabolism and global hypometabolism. Certain times when a comparison was done with MRI of the patient, there were regions of focal cortical dysplasia that were identified that corresponded to the regions of hypometabolism. But there were certain times where there were no obvious structural anomaly or deformity detected. But with the assistance of molecular imaging, the seizure onset zones were able to be identified. PET-CT can also be utilized to manage brain tumors. The clinical indication for PET-CT is for the identification of neoplastic tissue, including the delineation of tumor extent for the further diagnostic and therapeutic management of brain tumors. FDG PET could help to localize the region of the tumor that can be biopsied to get a definite diagnosis. and to decide on the margin for resection and for radiotherapy planning. PET-CT can also be utilized for the assessment of response to certain anti-cancer therapy, including predictive effects on the patient's outcome and the differentiation of treatment-related changes such as pseudoprogression and radiation necrosis from the tumor progression at follow-up. 18F-FDG PET-CT though has poor tumor to background ratio, and therefore other radiopharmaceuticals such as 18F-MISO and 18F-FLT are sometimes utilized for brain tumor imaging. 18F-MISO identifies regions of hypoxia in the brain and can be used to evaluate the tumor core that is necrotic. And 18F-FLT identifies tumor proliferation index. So multimodal imaging of brain tumors are very useful for the functional imaging of tumors and to assess whether there are recurrence of tumors post-surgery. In this patient, a comparison of gadolinium enhanced MRI correlated with the 18F-FDG PET-CT scan and carbon-11 methionine, which is similar to the MISO. It identifies areas of hypoxia. And 18F-FLT for the tumor proliferation were analyzed synchronously. And in this patient who had a glioblastoma, there was evidence of disruption of blood-brain barrier, and peritumorous edema was visible on MRI. And there was increase in the glucose turnover in the tumor with reduction in the surrounding tissue. And there was increase in the methionine uptake in the tumor core, showing areas of hypoxia due to the necrosis of the tumor, and infiltration by surrounding brain tissue. There was infiltration into other brain tissue that was not so evident on the structural imaging that could be seen in the FLT PET-CT, which indicates the molecular imaging can identify microscopic disease. PET-MRI is another emerging modality for the assessment of brain pathology. It can be done in a hybrid PET-MR scanner or can be done in two separate scanners, an MRI or PET-CT scanner, and later can be co-registered using imaging software. Here at PPDN, we have a 3 Tesla MRI and a PET-CT scanner where we can perform PET-MR co-registration to identify a good anatomical localization of lesions. In summary, PET-CT is a useful modality to diagnose certain neurological conditions. 18F-FDG PET-CT can detect patterns of glucose hypometabolism in various types of dementia, and looking at the pattern, we are able to classify the potential subtype of dementia. And amyloid imaging can help to non-invasively diagnose Alzheimer's disease by giving evidence to cerebral amyloid pathology. And interictal plus minus ictal PET is useful using 18F-FDG as the radiopharmaceutical to identify the seizure onset zone that may potentially be surgically resectable for the management of refractory epilepsy or breakthrough epilepsy. And newer radiopharmaceuticals can be used to image various brain tumors, signaling pathway, the hypoxia and tumor proliferation can be evaluated with 18F-MISO, 18F-FLT respectively. I would like to acknowledge this presentation was assisted by the 18F-FDG PET-CT on Alzheimer's disease at PPDN UPM, which was funded by Universiti Putra Malaysia Research Grant, Grant Penyelidikan Individu Berprestasi Tinggi Putra GP IBP 2017-940-900 awarded to Prof. Iqbal Saripan and team. I would also like to thank the staff at the Department of Psychiatry and the Memory Clinic of the staff in Hospital Serdang, Malaysia and Hospital Kajang, Malaysia. I also thank the imaging staff at PPDN, the Center for Diagnostic Nuclear Imaging, University Putra, Malaysia, for providing excellent PET-CT images for this research. I would like to express my gratitude to the Nuclear Medicine Unit of the Royal Liverpool and Broad Green University Hospitals, NHS Trust, and my supervisor, Professor Dr. Shoban Winjomori, during my fellowship there, awarded by the International Atomic Energy Agency, IAEA Vienna, for granting permission to use anonymized images from the hospital database for this presentation. With that, I would like to thank you and hope you have a further enjoyable training.